Now, the Ministry of Health, in collaboration with the UNICEF and partners, will be conducting an urgent 10-day measures, measles rubella vaccination campaign in 22 counties. Currently, less than half the children in Kenya have received both recommended doses. So I'd like us to cross over and listen in live to that launch.
Supplementary immunization activity, this is the reason we are doing it. We are doing it, number one, because our national coverage is not yet at more than 95%. Number two, the county coverage is not more than 80% across all the counties. What basically means is that we have a large number of children who are prone to getting the measles rubella disease. So this is a table that is going to explain how we accumulate the numbers. So every year, we do have an average of around 1.5 million children who we target for vaccination. So in 2017, we do have the first column. This is the target of children who are born and who are expected to be vaccinated. So at the end of 2017, these are actually the number of children that we do vaccinate. So what basically means that we do have some children who do not receive vaccines, measles, rubella, and also the other vaccines. And then for measles, so measles, not all children who are given measles at 9 months actually build an immunity response towards measles, build an immunity. So basically it means that 15% of the children that are vaccinated at 9 months are like non-responders, so they don't have immunity against measles. So at the end of it all, we get a cumulative number of children who are susceptible to getting measles. So that is for 2017, and then we do the same for 2018, we do 2019, and we have 2020. So in 2020, you see the cumulative number of children who are susceptible to measles disease are more than 2 million. More than 2 million basically means that it's more than the number of children who we are targeting for measles rubella vaccine at any one given time. So it's more than the birth cohort. And I've highlighted this population in that you've seen that from 2017 to 2019, the number of children who are born every year increased gradually. But in 2020, it's a little bit low because of the census that we did in 2019, so we had a revision of the population estimates. So if you are to report, this is what you are going to report. The number of children who are susceptible to getting measles are actually more than the birth cohort for 2020. So as a result of what we've gone through, these are the trends of outbreaks in terms of the counties that have been affected. In 2017, we did have these 2 counties that had measles outbreak. In 2018, we had the number of counties that are reporting measles outbreaks having been increased. And then in 2019, the number is actually larger. In 2020, we know the effects of COVID-19 pandemic on the healthcare system. So basically means that more children, there are more counties that are reporting outbreaks, and the 2 million children that we talked about are actually at risk of getting measles rubella disease. So in 2021, if we don't do anything, we are actually sitting on a disaster. So that led to the risk analysis that we did in 2020 to implement, to actually see how to mitigate all those outbreaks that had been occurring in those counties. So what we did, with the help of WHO, we did a risk analysis based on those 4 parameters. So we looked at the surveillance indicators, we looked at threat analysis, we looked at immunization performance, and then we did categorize counties based on scores, depending on their risk of getting measles rubella outbreaks. So we have the low risk, medium risk, high risk, and the very high risk. So in the very high risk counties, these are the counties where we are going to be doing the measles rubella campaign. These are 22 counties all over the country, and if you remember the other slide, they are the counties that have been reporting outbreaks of measles over the years from 2018 up to 2021. So again, in summary, remember that measles is a highly infectious disease. It spreads from human to human, and then it spreads more like COVID. It's a respiratory infection, so through cough, through sneezing, and then the symptoms include cough, red eyes, and running nose, especially in children, but can also be in adults. So we've seen that the reason we are doing this measles rubella campaign is that the number of children who are unvaccinated or who are susceptible to measles rubella are actually more than the birth cohort. So around 2 million children are at risk of getting measles rubella. And then we've seen that there are counties that are at a higher risk of high-risk counties, and these are the 22 counties where we are going to be focusing in terms of doing the measles rubella campaign.
So there you have it. The Ministry of Health, together with UNICEF, have launched the vaccination exercise for measles rubella. 22 counties are targeted during this vaccination exercise, and these 22 counties